Hello, I'm Karma Kitaj, and I'm your host for A Livelihood, New Adventures as We Age. Today I'm going to introduce you to Martha Hayward, and Martha is from the Conversation Project, which is part of the Institute for Healthcare Improvement. And we're going to talk with Martha today about what exactly prompted her to get involved in something called the Conversation Project. So welcome.
Thank you.
So I heard you speak at a meeting not too long ago of the Life Planning Network, and you talked about your work with the Conversation Project, which has to do with having end-of-life conversations.
That's right. That's right.
As you say, something that's not such an easy sell for people, right?
Well, it's funny. I've just come here from a long planning meeting. Now that we're in our second year of really launching the Conversation Project, we're moving into our second year, and what we're finding is the receptivity is incredible. The time is right for this project, although it's never easy to talk about death.
Why don't you spell out exactly what the conversation is and what it's trying to do?
Well, the Conversation Project was started about 2 years ago by a group of people headed by Ellen Goodman. And
Ellen, of course, is a
Pulitzer Prize-winning
columnist.
columnist, syndicated, and she really has chronicled social change throughout her career. So once again, not a surprise that she'd be the person bringing it to the fore. But it was after the death of her own mother that she realized, we're all ill prepared to face the decisions. I mean, now with the technology that we have available to us, death is no longer a natural part of life. It's a technologically assisted event, and we've lost touch with it being a natural part of life. And because there are decisions, because of the technology and the advancements, the wonderful advancements in science, we are often faced with decisions, simple decisions. I wonder how many of your viewers have had the following phone call. Your mother has pneumonia, and we want to know if we should treat it. That's a question that a lot of people are asked, and behind that question is this the time to allow natural death to take place? The conversation about end of life should be happening at the kitchen table, not at the examination table, or worse, the operating room table, or in any way in a hospital. That's really too late. So that when people arrived at the hospital, they'd be prepared to say, these are my wishes, these are my loved ones' wishes. The healthcare systems have been at this for years and years, trying to improve the way the end of life happens within the system. And it hasn't taken hold. And the missing link was the public. And so the Conversation Project is very simply, has been created to ensure that all people's end-of-life wishes are expressed and respected.
And I believe that on the website for the Conversation Project, you have published some guidelines for how to have this sort of conversation. Right?
Yes.
Do you want to just state briefly what people might find there?
Well, yes, because this has been a wonderful experience in putting the website together. The starter kit that we have, what we find is people often ask, but how do I start? And this is an uncommon conversation, and it's an uncomfortable conversation, and so we found ways to help people with just how to approach having the conversation. And the starter kit is a very simple, it's sort of a 4-step process. How do you get started even thinking about it? How do you invite people in? Some suggestions on how to actually, what you might say to your spouse or your kids or whoever it is with whom you want to have the conversation. What you might say to them to invite them in. And then how to actually approach the conversation. People get into the conversations about what does being present really mean. Is it being able to see, to hear, to feel, to communicate? Is it being able to know somebody's presence, to feel love? There are all these wonderful questions. And I think the process of going into the conversation, what we found has just been a rich experience for people. When there's disagreement among survivors, the stress and it can break families apart and leave people unhappy and feeling incredible guilt as to whether they made the right decision or not. So we're trying to mitigate that.
Martha, you don't come from a healthcare background.
Right.
So you are really the public.
Yes, I am. I am John Q. Public. That's right.
So why don't you let us know, how did you get involved with this?
Okay.
Why is this important to you?
All right. And it is very personal. It is very important. Yeah, if you had told me a few short years ago that I would be involved in the healthcare industry, I would have looked cross-eyed at you and thought, no, you really don't know me at all.
You had your own marketing.
I had my own marketing company. I live up on the North Shore. I've always been in marketing and communications. And basically, I had no purpose, I had no reason to access the healthcare system. I had my regular checkups, and I had my children in hospitals, and that's all I really needed the healthcare system for. Until my sister was diagnosed with cancer. And she had just turned 50 and went in she decided to get all her baseline appointments taken care of. And 2 weeks after her 50th birthday, was diagnosed with breast cancer. And about 2 months after that, when I was sitting with her at one of her chemotherapy sessions, it occurred to me that I hadn't actually had a mammogram in about 2 years. And I was 48 at the time. And so I thought, well, I better get a mammogram. Well, the short side of that story is that I was diagnosed with cancer in both breasts. And during that experience, my sister and I had one another to go to, day in and day out. She was at one end of Boston at a hospital there. I was at another end of Boston. And my sister and I were fortunate enough to have gone through this together. I mean, it sounds silly, but we were fortunate to have breast cancer together.
You're fortunate to have each other.
We were
to
fortunate.
talk to.
It's exactly right. We were fortunate to have each other. And what I'd like to say is that we both, but I know that I survived because I had outstanding medical care.
So how did you become the advocate, the powerful advocate that you are now?
Well, a friend of mine had a child at Dana-Farber about 10 years prior to my cancer, 15 years prior to my cancer. And he's been a wonderful friend. He and his wife have been friends for years and years. And when I was diagnosed, I saw him on the street, and I told him, and we burst into tears. And he's crying, I'm crying, we're hugging. And then he pulled me away, and he said, oh, this is wonderful, which I wasn't really getting at the time. You know, it just didn't feel that wonderful to me. And I said, why? And he said, because when this is all over, you have to be on the advisory council at Dana-Farber. And it turned out that Dana-Farber is one of the original patient family advisory councils. And he
around the country. You mean.
Around the country, that's right. And this friend of mine, Gary, when he did two things for me in that moment. One was he shocked me, but the other one was he showed me that I was going to see my way through this.
So your personal experience with being treated for cancer, and you and your sister as well, really galvanized you and helped you to become this powerful patient advocate.
Well, and I have to say that Dana-Farber's the way that Dana-Farber has embraced, and now other hospitals as well, have embraced the true input and the depth of input that patients and families can have in transforming the way they deliver care. That's what really galvanized me, because I saw purpose.
So I think we can stop with that message.
Wonderful.
You know, because that's your best message, really.